Hello guys, and welcome to the lung sounds videos. So I know this can be kind of a confusing topic for a lot of medical students. So we're going to start with crackles. Crackles can sound really harsh, and it's due to the opening of the small airways and the alveoli. So what happens is that when you breathe out, whether you have fluid or an infection or anything inside these small airways, it causes them to kind of fall together. So when you have to breathe in again, you have to force them to breathe in again, and it causes that harsh sound that you hear, and that's what crackles are for. So again, if you hear early inspiration crackles, that's usually due to bronchitis, and if you hear late inspiration crackles, that can be due to other disease processes like pneumonia, CHF, ARDS. So I'm going to play so you can hear them. So these are coarse crackles. Crackles and rails are the same thing, but now a lot of doctors, they don't like the word rail, so just call them crackles. Wheezes, it's like whistling, salivation, both expiration and inspiration face, and it's caused by narrowing of airways. Start thinking of COPD, asthma, of course, and a foreign body if it gets into there as well. So as far as wheezing goes, there can be high-pitched, low-pitched. A lot of times I feel like it sounds like a little child screaming, like. And then another thing, if you hear the word rhonchi, so rhonchi is actually like a type of wheeze. The difference is that it's usually related to bigger airways when there's like something obstructing those bigger airways, but just as wheezing, it can be heard during inspiration and expiration. Rhonchi are like, they're not as loud, like as high-pitched as wheezes. Are more lower, so let's go ahead and hear them. So as you could hear, that rhonchi are basically just loud pitched wheezes. Let's move on to stridor. So if you're going into internal medicine, probably you won't hear stridor that much, unless it's like in the elderly. Maybe they had a stroke and they accidentally swallowed something. So stridor is a high-pitched, continuous, mostly inspiratory, because think about if something's stuck in here when you're trying to breathe, that's when the air kind of gets stuck, and that's when you'll be able to hear it. So upper airway obstruction, mostly seen in kids, conditions like epiglottitis, foreign body aspiration, and croup. So stridor sounds harsh. It's a high-pitched wheezing, and that's when you're trying to breathe in. And then you can go online and be able to find all these types of pulmonary exams. Okay, now I'm sure you guys have heard of bronchophony. So bronchophony is you'd have a patient say 99, 99, 99. And physics tells you that sound is transmitted better in more solid type of things. So if a patient has a consolidation, you tell them 99, 99, 99, 99, right? You go through all the lung fields. And if you can hear it clearly, then that's most likely, evidence that the patient has a consolidation on that lung field. And the difference between bronchophony and the difference between whispered pectoriloquy, I'm not sure how to say that, is that for bronchophony, you say it normal. Like you tell a patient, say 99, 99, 99, 99. But in whispered, they say 99, 99. You whisper, it's literally whispered bronchophony. So they say 99, then you auscultate, and if you hear, the sound perfectly, then that means that because this consolidation, or because of, there's something in there that's making the fluid more dense, you're able to hear those 99 better. So for agophony, it's similar to, the same to find out if there's a consolidation. You have the patient say E, E, E. So the high-pitched sound gets converted. If there's a consolidation, the sound will transmit the high-pitched sounds into lower-pitched frequencies, and the E will sound like an A. So I'll say, you know, E, 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 and when you hear it, the patient will sound like they're saying ah, ah, ah. And then with tactile fremitus, you just feel it, and if there's a consolidation, when the patient says, you'll be able to, it'll be able to be felt harder, and you could, you know, hear it. So all of these are similar exams to find out if a patient has consolidation in their lungs or any other disease processes like a tumor maybe. Yep, so thank you.